We'll go on to item number 1 on the file, ACA 14. Member Lorena Gonzalez, please.
Thank you, Mr. Chair and members. ACA 14 is simply a resolution that asks the voters whether the University of California should ensure all workers who perform support services at the UC are afforded the same equal employment opportunity standards as the UC employees. Beyond providing world-class instruction and research at its campuses and medical centers, the UC is the state's third largest employer and is an anchor in the communities in which it operates. In recent years, the UC has outsourced an estimated 7,000 support jobs, while at the same time increasing the number of highly paid administrators to approximately 8,100. This resulted in an annual administrative payroll cost increase of $64 million. This amount matches the amount that UC has previously estimated would cost to offer outsourced workers the full protections and equal employment opportunity standards enjoyed by the UC employees. ACA 14 will protect service workers at UC from policies that produce economic, racial, and gender discrimination. To be clear, neither the legislature nor the governor can address the systematic inequalities that occur to the UC's autonomy under Article 9 of the Constitution. However, Article 2 of the Constitution gives the legislature the power and responsibility to allow voters the opportunity to protect the most vulnerable residents of our state. I simply ask that you allow the voters to decide whether low-income service workers at UC, those who clean the toilets, mow the lawn, serve our food, and clean the bedpans should enjoy the same standards enjoyed by UC employees doing the same work. Witnesses here.
Thank you, Senator Member. And as is practice for this committee, each side can have up to 6 minutes, split up any way that the proponent chooses or the opponent chooses when that time comes.
Catherine.
Good afternoon, Mr. Chair and members. Catherine Leibarger, President of AFSCME 3299. I have had the chance to meet with many of the members of this committee, and I thank you for your time, and for the several of you who have co-authored, I want to thank you for doing so. The people that we're talking about in ACA 14 are doing the dirtiest work at the University of California. They're cleaning the toilets, emptying the bedpans, picking up trash. We are working class, blue collar. We cook the food, maintain buildings, and support the doctors, nurses, faculty, and students at UC. We are cleaning, fixing, and helping to make one of our greatest educational and public institutions run and succeed. We're also the invisible but essential people at UC. We are the ones in your districts trying to make ends meet. We are the people that you're talking about when you make policy around affordability, housing, and healthcare. And yet the public standard and practice has been that we are to be treated less than, not equal to everyone else at UC. We are the only group of employees being outsourced at the greatest rate at the university. The governor and the legislature, together or separately, do not have the power to change this. So I ask you to consider placing this issue on the ballot for your voters to decide. Thank you.
Thank you, Mr. Chair and members. My name is Arthur Liu. I'm simply here to serve as a resourcer and answer any questions if there are any.
Thank you. Anyone else in support?
Mr. Chair and members, Brian Ha with the California Federation of Teachers. We're in strong support. Thank you.
Mr. Chair, Brian Allison on behalf of the American Federation of State, County, and Municipal Employees, here in strong support of the bill, also in strong support of our affiliate 3299.
Thank you, Mr. Chair and members. Mitch Steiger with California Labor Federation, also in support.
Chair and members, Curtis Lang with the California Nurses Association, in support.
My name is John Rundon. I'm the VP of Legislation for the UCFT, the union that represents librarians and lecturers at the University of California, and we stand in strong support of this measure.
Honorable Chair and members, Amy Heinscheich with the University Professional and Technical Employees, Communication Workers of America, Local 9119, in strong support. Thank you.
Kimberly Rosenberg with Service Employees International Union, and proud to join our brothers and sisters in strong support.
Ken Wang on behalf of the California Employment Lawyers Association, in support.
Thank you. Is there anyone in opposition? Okay, and as I previously stated, you have up to 6 minutes split up any way you choose.
Thank you, Mr. Chair. Mr. Chair and members, Jason Murphy on behalf of the University of California, here with my colleagues from the UC Health and others in strong opposition to this bill. I want to state for the record that the University of California takes its responsibilities to maintain a stable in-house workforce very seriously and to utilize contractors for specific business purposes in a limited and responsible manner. As you know, the university has a unique mission of teaching, research, and patient care. And the university seeks to address this balance by ensuring through our collective bargaining agreements that there are opportunities to ensure displacement is not a problem with in-house staff. The university has in our collective bargaining agreement conversations language that prevents the university from contracting out solely to save money. And so therefore, the university does contract out in situations where we need special expertise, special experience, or situations where special equipment is required and the like. As such, we address these cyclical and episodic workload needs for circumstances such as cleaning out residence halls at the end of the term, clean up after sporting events and so forth that are held from time to time, as well as performing such activities like maintenance and other types of landscaping needs that require specialized equipment. I'm thinking of tree trimming, things like that here. Again, I want to reiterate, UC does not displace workers as a result of contracting out. In fact, the ranks of the union represented workforce at the University of California has grown over the last 5 years. 9.9% overall, and if I look at the AFSCME numbers in particular, 17.1% in the last 5 years growth in the numbers of represented employees in those particular categories. I know this isn't the fiscal committee, but I would point out real quickly that the university has pegged the fiscal impact of this bill at $172.6 million per year as a result of the insourcing premium we would have to pay. The university also wants to make clear that we understand and respect the concerns that have been expressed by our employees. We do remain committed to working with our labor partners, and we have been working steadily at the collective bargaining table to resolve a lot of these exact issues that are raised in this bill. We do believe that's the appropriate point to address these concerns, and putting an ACA into effect only would tie the hands of both our universities and our labor partners to solve these labor issues going forward. Thank you.
Thank you.
Good afternoon, Mr. Chair and members of the committee. My name is Angela Gilliard. I am the Director of State Health Policy for UC Health. The mission of UC Health Systems is to advance the health of society through health-related education, research, patient care services. UC has 5 nationally ranked academic medical centers and 18 health professional schools. Nearly 50% of medical students and medical residents are trained in California. UC medical centers are financially self-sustaining, and the income generated by the UC medical centers provide financial support to our professional schools. Our medical centers are public safety net hospitals that must keep their doors open to all patients and some of the most seriously ill patients needing highly complex care. Every hospital, including UC, must have mechanisms to achieve flexible staffing to respond to changes in patient census and acuity on a daily and even shift-by-shift basis that demand higher levels of staffing. Changes in patient acuity and census require adjustments to not only patient care staff such as vocational nurses, patient lift and patient transportation, patient transport technicians, but also to critical operations support like staff like janitors, food service workers, etc. Outbreaks of contagious illnesses, surges in trauma cases, and continual changes in conditions and mix of admitted patients can strain existing staff. The restrictions established by ACA 14 would prevent UC hospitals from being able to obtain the staff they need, and this kind of policy is unprecedented in the state, we think, on any public institution, and would force, and in particular on hospitals, would force us to divert ambulances away from the emergency rooms, trauma centers, and could cause us to cancel and reschedule important medical procedures. Lastly, UC hospitals are highly regulated and operate in a highly competitive environment. Policy decisions like ACA 14 can have a long-term effect on our sustainability as medical centers and will negatively impact our ability to train the next generation of doctors and other healthcare professionals, and therefore we do oppose.
How much time's remaining?
1:15.
All right, I'll try and do my best. All right, so we're coming at it from a different perspective. Obviously, I can't duplicate or even speak to some of the statistics that the UC providers just said. We're coming at it from the business perspective, which obviously provides the contracts that the UC utilizes for these support services. I would suggest that it's not just a limitation. This is potentially a ban on the use of contracting. One, because it says you have to come back to the legislature and get statutory authority for any contract. And two, only if you do that can you have 10 days of employment, right, under that contract. I don't know what business is going to wait, one, for potentially a whole legislative cycle to get approval for a contract, or two, after waiting that long in that time period to only work for that contract for 10 days. It's not financially an incentive for the company to do it. So essentially, I would suggest that this is a ban. And I don't understand how the bill would even work with respect to one of the provisions says that you can have a contract to perform support services. It's an unanticipated special event to the university with 30 days limited notice. How do you reconcile that with then having to go back to the legislature to get approval for that contract and be able to address that situation, that unanticipated event within 30 days? So I think it's a challenge. So we'll potentially in the private sector lose jobs, but from a different perspective, the number one issue that our companies have is the workforce and being able to have an educated and dedicated workforce. And to the extent you restrict the budget of the UC, limit their ability to devote funding to the sources of education, professors, support services that are needed to provide that education in an efficient and cost-effective manner, we have concerns with how that will impact the growing and trained workforce that we rely upon. So from those reasons, we are opposed.
Thank you. Any question, or anyone else in opposition? I apologize. Anyone else in opposition, please state name, affiliation, and position.
Kelly Brooks, I'm here on behalf of the California Association of Public Hospitals and Health Systems, and we are opposed.
Thank you.
Maurice Richardson on behalf of the California Hospital Association, and due to our concerns for patient safety, we are opposed to this bill.
Thank you. Anyone else? Okay, bring it back to committee. Questions, concerns, comments, thoughts, motions?
Do we move the bill? Because I'll move the bill.
Thank you. Is there a second? Thank you.
So, first of all, I would love for you to add me on as a co-author, if I hadn't done it already.
I think you are, but yeah.
Okay, we'll just make sure.
We'll make sure you're on there.
I may have been waiting.
He's not yet, but he is now.
Yeah, I may have been waiting until you added the real problem, which was going to the voters to change the tenure of the UC regents, which I consider the real problem. Look, they can outlast 3 governors and 2 legislatures. Only kings, queens, and dictators have that much tenure in the world. And so they can ignore us. Mm-hmm. That's why they have to come back to us to talk about it, because they've done it in the past as far as the UC regents. I worked for the city of Los Angeles for 25 years, and I've worked with public employees. I've also worked with the private sector ones that were brought in. 9 times out of 10, we did a much better job than the private sector. 9 times out of 10, after you hired them at the lower cost, with the change orders and the other things that came in later, after 5, 10 years, you're paying more than you did with the public sector. But that's never incorporated. I'm not pointing at you to be mean, but that's never incorporated in the analysis. It's usually at the front end. This is how much we save, but no one ever does an analysis of how much they ultimately spend on the back end. Because quite frankly, we're not very good at writing contracts. And we have to do change orders all the time. I used to write contracts, so I know I wasn't always that good. And so the taxpayer ends up paying more when they had the best group working for them at that time doing the work and experienced people doing the work. And so I not only commend you, but some of the things that they brought up, I'm glad, especially the part about coming back to the legislature, because no governmental body should be able to just run amok and not have any oversight. Mm-hmm. Technically, they have no oversight at the Board of Regents, and they can just do anything they want. And I wish we had added that into your bill, that we would give them 4-year terms so they would learn how to listen to other people and take in their input and not just do whatever they felt they wanted to do. And so I will be a yes and a yes and a yes.
I appreciate that, and I think if we added that into this, we might violate the single subject rule, but I would be happy to work on that with you in a separate ACA. I think that's an important feature.
Any other questions or comments? I want to also thank the author, and there's clearly, when it comes to some of the specific issues, those are the kinds of things that in some cases can get worked out as bills go forward in terms of some of the details. I'm sure it'll be appropriately vetted at fiscal committee when that time comes. I will also say that when it comes to healthcare competitiveness, I agree. We have to do more on cost containment in general in our healthcare system to make our public systems more competitive. And I think that that's one area that we're going to continue to focus on. And I'd also agree with Assemblymember Jones Sawyer. In my experience when I was in the city of San Jose, when we lost a lot of public workers and we outsourced a lot of our functions, we found that not only were we paying more, but we were getting less out of it, and that where the delta was profit to a private contractor. And so I think there is really, when we're using public dollars, we do have to be cognizant of where they go. But more importantly, I think we want quality work, and we want to make sure that we support our workers. And I think there's about close to 50 members and senators that, as this bill, if it gets through this committee, are going to be added as co-authors. I'm honored to be added as a principal co-author of this bill, and I'm very pleased that our vice chair, as well as Senator Diep, are also being added as co-authors to show that this truly is a bipartisan issue when it comes to ensuring there's accountability and protection of workers. And so with that, we do have a motion on the table. And so, Madam Secretary, if you can call roll, please. Oh, actually, Senator Gonzalez, would you like to close?
I'll take that as my close.
Okay.
Unless you'd like to read the names of all the co-authors.
We'll be here for a while, and that's a good problem to have.
It's a good problem to have.
Motion is due pass as amended to appropriations. Calra.
Aye.
Calra, aye. Flora.
Aye.
Flora, aye. Carrillo. Carrillo, aye. Diep. Diep, aye. Gonzalez.
Aye.
Gonzalez, aye. Jones Sawyer.
Aye.
Jones Sawyer, aye. Luz Rivas. Aye. Luz Rivas, aye. That bill is.
Thank you.
Thank you.
Thank you, Senator Gonzalez.